a wide variety of technical assistance and support, whatever the needs are for the different projects. We try to respond to those. And we do this while respecting the autonomy of California's tribes. So this slide shows our team. Our core staff consists of Nazba Ben. She's our Director of Tribal Projects at ETR. We currently have 2 projects. In addition to the Tribal Community Coordinating Center, we also have California's Clean Air Project. Then there's me. We have Samuel Black, our Community Outreach and Engagement Coordinator. Treble Vasquez is our Media Coordinator. And then this shows some of our amazing support staff pictured here. But we also have a large multidisciplinary staff from throughout our national nonprofit organization, ETR, and everyone works together to help make this project run as smoothly and successfully as possible. Next slide. This slide shows the funded tribal projects that we're currently working with. So there are 12 tribes and then 5 different tribal serving organizations located all throughout the state. We have the Yurok tribe and United Indian Health Services in the far north, and then it goes all the way down throughout California. We have 4 funded tribes in San Diego County. Next slide. So this slide highlights the differences between commercial and traditional tobacco. Many tribal communities have a long history of tobacco use that varies widely between groups. Traditional tobacco has ceremonial, social, and medicinal value, and it does not cause harm to the environment or to individual health when used as intended. And then on the other hand, commercial tobacco has toxic additives, it's highly addictive, harmful to health, and it's extremely destructive to the environment. So our efforts are aimed at reducing the use of commercial tobacco only, and part of this includes teaching about and reclaiming traditional tobacco. So we differentiate between the two. That's very important. Next slide. Today, we'll be talking about commercial tobacco retail policy in tribal communities. So we have 4 priority areas outlined in our policy platform. This is the 4th of 4 different webinars. So we had the first 3 webinars that focused on the other areas, which were cessation, smoke-free spaces, tobacco product waste, and retail policy and excise tax is the 4th priority area. It only applies to a few of our projects. Some, but not all tribes do sell commercial tobacco products. The decision of whether or not to participate in this market, it's dependent on many factors, and it's made individually by leadership. So it can be a very lucrative source of revenue. Since tribes are not subject to state jurisdiction under many circumstances, states have limited authority to impose taxes on tribal lands. And since tobacco is heavily taxed by the state and other retail locations, this really creates a very attractive environment for the tobacco industry. It also means that gas stations or smoke shops or wherever it's sold can and do provide a desperately needed source of revenue that really opens up opportunities that didn't exist before for tribal communities. Tribal governments have the power to enact laws and regulations regarding the sale and distribution of tobacco products on their lands. So laws and policies can cover various aspects such as vendor licensing requirements, how to include and display health warnings, product marketing, placement within the shops, product bans or restrictions. Tribal governments can require businesses to obtain licenses to operate on their lands. And then they may have specific requirements and fees that must be paid to the tribal government. They also determine how the taxes and fees are allocated. A lot of that is to offset harm and benefit the community. So taxation, like everything else, can vary widely between tribes, and it's often used to fund tribal programs and services depending on needs. And then before we move on to the next slide, I have a question for you. Treble, you want to launch our question?
Gotcha on the question. Give me 1 sec, sorry.
Oh, it's in the chat. Okay, I didn't see the chat. So the quiz question is, what does tribal sovereignty refer to? A, B, C, or D? You can put your answer in the chat. CCC staff cannot participate. Okay, so the correct answer is B. The right of tribes to govern themselves and make decisions for their communities. Okay, can you go on to the next slide? So tribes are sovereign political entities with the inherent right to self-govern. This includes the right to enforce laws and manage internal affairs on their own land and protect their people, their culture, and their natural resources. Sovereign rights existed before the arrival of colonial settlers and Europeans. Native Americans lived in distinct communities with complex social structures, so they were already self-governing. That right was retained through negotiations and legally binding treaties that were signed. They don't expire. This required a lot of sacrifice. Tribal nations lost the vast majority of their homelands in exchange for their treaty rights. Sovereignty was not a special gift or privilege bestowed upon tribes by the US government. It's a protected right that was retained. It's a government-to-government relationship between tribes and external entities that includes local, state, and federal governments. So it does get very complex, but it's important to recognize that this relationship is vital and it's protected by the US Constitution. It allows tribes to negotiate agreements and maintain their own distinct political status. It protects culture and resources. Every tribe sets their own policies, responsible for creating their own constitutions. They're all a little bit different, holding their own internal elections, determining term limits for their leaders. We outline eligibility for enrollment. It looks different from tribe to tribe. And then just overall deciding what policies best support the needs of each community. Tribal leaders are really busy people. They have a lot to weigh. They make important decisions about healthcare, education, housing, infrastructure, basically all of the programs and services that exist in the community. I mean, they're responsible for their people, and this means there are so many considerations to be made when making decisions about economic development. Next slide. Engaging in diverse sectors, it allows communities to generate their own revenue and become less reliant on external resources. It reduces dependency because it empowers tribes to address needs and respond to them in ways that they determine. Native Americans still experience the highest rates of unemployment and poverty out of any minority group in the United States. So healthy economic development creates opportunities for tribal members. It's essential to improving the overall quality of life. Tribal communities are recovering from a very difficult past that included forced relocation, marginalization, and this intentional exclusion from opportunities that were available to a lot of other people, but not available to tribal members. So now we see communities taking control of their own economic outcomes. And it's extremely important not to interfere with this in a way that will cause further harm. Tribal enterprises are not unlike other businesses by nature in that they will seek to capitalize on a market demand and opportunity. However, they are unlike other businesses because the revenue generated supports the tribal government, social services, and also gets redistributed to all members of the tribe. So it's a long-term process, and we see that certain enterprises like gaming and tobacco have provided tribes with the resources to access additional opportunities. So for example, clean energy, entertainment, tourism. So more and more we're seeing this diversification and participation in the broader economy, and it really allows us to be less dependent on industries that do cause harm. Next slide. So my hope is that this information helps you to approach the topic of retail policy and tribal communities from a different and unique perspective, because it's really a complicated issue. Moving forward, we have to be mindful of how we confront historic injustices. Tribal communities have faced a long history of colonization and forced assimilation, devastating loss of land and resources and people. So respecting tribal sovereignty and the decision-making authority is really an acknowledgement of these past injustices, and it's a step toward addressing a lot of those historical wrongs. Another way to support healthier policies in tribal communities is to foster meaningful relationships that are built on trust and respect, and those relationships do take time to build. Tribal governments, and then just tribal people that are working on these projects, they collaborate with external entities such as public health agencies, nonprofit organizations, or neighboring jurisdictions. And this really helps to gather information, share best practices, and provide and receive technical assistance for developing tobacco retail policies that align with public health goals. Non-tribal people can and do play a valuable role in supporting economic development and policies, but it should be done in collaboration and partnership with tribal communities. Respecting tribal sovereignty and leadership allows for genuine engagement and shared decision-making and mutually beneficial outcomes. Many tribes have already set goals to limit or move away from the tobacco industry, so work is ongoing and momentum is building to reduce the harmful impacts that have been occurring for generations. And now we want to dive into some of the specifics of that work. So I am going to hand it over to my co-presenter, Jay Macedo, to talk about some of these efforts.
Thank you. I appreciate it. Way to set me up. That was great. That was great framework for what we're going to discuss today and what I'm going to present. So Ayakui, hi, my name is Jay Macedo, and I'm an enrolled member of the Yurok tribe, and I'm also of Hupa descent. I'm an evaluator with several of the tribal tobacco projects. And I also work with jurisdictions in Humboldt County, cities and the county on tobacco retail licensing in their areas as well. So it's a little bio of me, and me with like blonde hair. I don't know what the lighting was. I don't have blonde hair, but it looks blonde there. So not sure about that. At any rate, currently I'm working with Coyote Valley on tobacco retail licensing and flavored tobacco ban. I'm going to share a little bit about tobacco licensing policy in general and the potential for tobacco retail license policy for tribes in California. Do I just tell you can you push it forward or move forward?
Yeah, just whenever you're ready, let me know.
Okay, there's not a special sign or anything. Okay, can I move forward? Thanks. And this was just this last weekend. I was coming back from Hupa, and this gorgeous, as we were coming down, this like gorgeous sunset came up like this, and I just wanted to share that with everybody. I thought it was really beautiful. Oh, okay, next. Next slide, thanks. So today I'm going to provide an overview of tobacco retail license policy, or TRL as it's affectionately known among TRL advocates all over. Then I'm going to look at the tribal tobacco retail landscape, what very little we really know about it, but I'll share a really good study there. Then I'm going to talk about the benefits of tribal TRL policy. And finally, we'll have a little small group discussion on the future implications of tribal TRL policies. Next. So at this point, I really want to make the distinction between, Ravina gave a great distinction between commercial and traditional tobacco. So the only tobacco I'm talking about regulating is commercial tobacco. So that's what this part is going to be focusing on only. So the retail environment is one of the primary avenues for youth to obtain commercial tobacco. It's not the only one, but it's definitely one of them. Therefore, one of the most effective interventions to address youth smoking and vaping is through a local adoption and implementation of a TRL, or tobacco retail licensing. A TRL is a license issued by a government entity that requires a retailer to obtain a local license to sell tobacco products in their jurisdiction. Over 200 cities and counties in California have adopted a TRL. Enforced TRL policies are evidence-based strategies, local strategies, to reduce illegal tobacco sales to those under 21. Across 33 California communities, sales to underage youth dropped by an average of 26% after implementation of a strong TRL. Next slide. As Ravina discussed earlier, federally recognized tribes are considered domestically dependent nations with inherent sovereign powers. The U.S. has a government-to-government relationship with federally recognized tribes. Thus, tribes are not subject to state government tobacco taxes. However, there is legal precedence that the state could impose tobacco taxes and so there is some legal precedence that the states could impose tobacco taxes, and 20 states have entered into some tobacco tax agreements with tribes, but California has not. Tribal tobacco businesses operating tribal lands do not have to obtain a California state tobacco license or a local county tobacco retail license if your county has one, or be subject to state taxes, as mentioned earlier. The Federal Family Smoking Prevention and Tobacco Control Act, also called the Tobacco Control Act, was passed in 2009 under the Obama administration, and it allows the Food and Drug Administration, or the FDA, to regulate the production, sale, and marketing of commercial tobacco products in the United States, including on tribal lands. The act is the following. It prevents commercial tobacco sales and marketing to youth. It was under 18 in that 2009, but now under 21. It stops misleading labeling and advertising of commercial tobacco products. It enforces FDA laws about the sale and marketing of commercial tobacco. And the important one here, I mean, it's all important, but important to this presentation today, is it preserves state, local, and tribal governments' authority to regulate tobacco products, to enact and enforce laws or regulations in addition to or more stringent than the Tobacco Control Act. So tribes can enact additional policies, tobacco laws, such as TRL licenses. Some tribes have adopted TRL, but many have not. The TRL monitors tobacco retailing and serves as a vehicle for current and future tobacco control plugins that provide more youth protections, like a flavored tobacco ban or limits on tobacco advertisements inside and outside of a retail establishment. Okay, next. All right. To gain more insight into the larger landscape of tribal tobacco retailing in California, I want to briefly review some of the results of a 2016 study entitled Understanding the Retail Environment on Tribal Lands in California. And this study was conducted by Dr. Claudina Toya and her USC crew. In this tribal tobacco retail study, there were 53 retail stores on tribal lands that were surveyed prior tribal approval. Stores within 1 mile radius of the tribal lands, and about 43 stores were approached once all the retail stores on the tribal lands had been approached to gather a larger sample base. Retail store owners, managers, clerks, and other employees were interviewed about their knowledge, attitudes, opinions, and beliefs regarding commercial tobacco products and marketing. The study also conducted store observations on tobacco advertising, product variety, and pricing. For the purposes of this presentation, I'm only concentrating on the results from the 53 retail stores on tribal lands. So 23 of the 53 tobacco retailers were inside or near a casino. Of the 53 tobacco retailers, as you can see from the graph here, 16 were categorized as tobacco-only shops, 14 were convenience stores, 13 were other, and 10 were grocery stores. All right, next. As part of the interview in this study, retail stakeholders were asked if they had seen the FDA's American Indian specific retailer training. And most of the 53 retailers had not seen this video. And they also responded to earlier study questions that most had not received training materials, or other education about the federal tobacco laws from the FDA. So this is just an example of many others that shows the lack of support and training around federal tobacco laws by the FDA. A tribal TRL could assist with maintaining ongoing retail staff training around federal and tribal tobacco laws. This could be very beneficial in that sense. Next. What are some of the benefits of a TRL? A few of the primary benefits of a tobacco retail license are: it reduces tobacco initiation and appeal among youth and reduces long-term commercial tobacco-related mortality and morbidity. It allows for tribal control and consistent monitoring and compliance training. It sets retailer standards and requirements for current and future tobacco sales on tribal lands, regardless of leadership or management changes in the future. A TRL provides the framework for additional plug-in protections that may be passed at the time or in the future. As I mentioned, we're working with Coyote Valley Tribal Tobacco Project to research a flavored tobacco ban plug-in for a tobacco retail license ordinance. A few other protections that could plug into a TRL, but are not limited to, are limits on the number and type of tobacco retailers, limits around tobacco advertisement and marketing, and restrictions on price discounts and promotions. As many of you know, the Public Health Law Center is a great resource, and they have a comprehensive TRL template with all of the additional plugins. The Yurok tribe, my tribe, and the Warm Springs tribe in Oregon have tribal tobacco retail policies in place and are examples of tribally adopted TRLs. As most of you know, you can work with the Law Center, and they can help develop a TRL that works for your tribe, that aligns with what you would like for your nation. So next slide. So these are just some discussion questions, or you could also come up with your own to kind of talk about the TRL policy in the tribal retailing and tribal nations. So this is a little bit of a newer type of policy. I think not as many tribes have been able to adopt this, or have known about this, or may see there's not a need for this. So it's a good kind of beginning initial discussion to kick us off. So thank you so much, and I hope we provided you with some food for thought about tobacco retail policy on tribal lands. Thank you.
Thank you, Jay. That was great information as usual. Next slide. Next slide. Okay. We also had a slide that showed some of the initiatives that the tribal projects are currently working on. We can send that out as a follow-up with the materials afterwards. We also had a request for the commercial tobacco versus traditional tobacco slide. So we'll send those out. If anything interests you, feel free to reach out to the tribal project staff or to us. We are always here to collaborate and share resources. Just a really quick recap. We feel it's very important to recognize and respect the inherent rights of tribal nations to govern themselves and to make decisions regarding their own internal affairs. But we will continue to support tribal communities as they work toward beneficial policies, and allies and partners are always welcome. So please continue to reach out if you need anything. We'd love to hear from you. And that flew by, so we're at time. We have a survey link in our chat. So we'd love to have you take the survey if you attended any of these webinars. And we'll also send that out by email. And now we have some optional discussion questions. So if you have time to stick around, we're going to go into breakout rooms and we're going to talk about some of the material that we covered today. Otherwise, feel free to ask us any questions. Thank you for joining us.